So it's February 2020. I'm invited by the WHO to go along as one of their representatives in their mission to China and starting in Beijing. And it was a defining moment personally, because you could just see nobody on the streets. A car might go past every 5 or 10 minutes. It was not the Beijing anyone could recognize. And that's when I knew this was scary. We looked at some of the data about how it could be transmitted. We looked at the case fatality rates, and we felt that the world was not ready and was not going to perform well in most cases. Different cities fell, starting with North Italy and then going to Spain, I think, and then UK and eventually the US. I recall this. I just wanted to stand on rooftops and tell everyone what was happening. It was like no one believed it was happening until it happened to them. And then the response was to lock down the city. It was just personally painful to know what we knew and then just watch city after city fall, mortuaries overflowing. And we saw this. We knew this was happening.
You know, one of the worst things about humans is that we forget the lessons we learn. I think the world went through a similar experience at the end of World War I in 1920 when the Spanish flu came around. That lesson wasn't captured in any way that is easily accessible. CIDER brings together a group of people who have experienced outbreaks before and infectious disease emergencies, and they know what is really important in these kind of situations.
There is a tendency for people to be domain experts. I'm an expert in virology, I'm an expert in clinical management, I'm an expert in logistics, but I think what we lack is that critical mass of people that really can have oversight over all the domains.
There's no point for us to keep that information within one center. We want to spread it out and everybody to know about it so that everybody can be safe together. The idea is, let's all work together, let's keep everybody informed, well-educated and well-trained so that we never have to really retreat into our shells again like we did in COVID-19.
During this period where we are not in a pandemic, what we call an inter-epidemic period, actually it's important for us to use the time wisely to see how we can improve ourselves. Society really changes over time in a very fast way. We're 15 years from SARS, and the way in which we did contact tracing for SARS and the way we did it for COVID was quite different, simply because Singaporeans were different in the way that they were moving around the country, different in the way that they use technology, and we do need to evolve the way in which we do contact tracing with how society also evolves.
I think if anything, COVID-19, the pandemic, has kind of brought the importance of legal frameworks because they really have a role in facilitating and speeding up the response to public health emergencies. There weren't vaccines for COVID-19 and they had to develop new vaccines, and because this was a new vaccine, the companies weren't actually willing to provide it without being released of liability. So some countries haven't already in place these legal frameworks. They could sign contracts very, very quickly and kind of, distribute these vaccines within the countries. But for other countries, they didn't have these kind of legal frameworks in place. And they had to invest even 2-3 months into kind of negotiating the contracts. So this is an example of something that if you already have that kind of framework in place, then that speeds up access to vaccines in case of an emergency.
When I look at the early phases of the COVID-19 pandemic and meetings that we had, a group of experts got together to talk about what this meant. But I have to say, where we didn't make sense in a way is we were completely focused on the epidemiology. How do you prevent a virus from spreading? And what are the different things that are available to us. And we came up with ideas of canceling classes at an academic institution and then ultimately lockdowns. But no one really said and completely made sense at that time of what the consequences of those things would be. No one talked about what are the mental health consequences, what are the economic consequences of those sorts of approaches, and kind of making sense of these events in a much broader and diverse domains than just epidemiology or just what happens in the laboratory. So we start with kind of the science, but it opens up into a much broader discussion, and we realize the consequences if we don't have that broader discussion earlier. And okay, what are the impacts of our various ways that we might approach this?
Many governments focus very much on the scientific, technical issue rather than addressing the concern, the emotional concerns of the people. They just threw the scientific facts at the public, hoping the public will understand. The average person in the street, you give them data, you give them statistics, it doesn't work. Communication is 20% what you know and 80% about how you feel about what you know. It's all about emotions. And especially when you talk about vaccines, like when Singapore declared COVID vaccines are safe for children, it becomes a very emotional issue with the parents.
The entire landscape and ecosystem is becoming much more complicated and complex. It's no longer about sending one team to deal with just the scientific aspects of the infectious disease itself. The end-to-end spectrum of emergency response involves so many different key stakeholders and players, and they all have their own expertise and their own role. And it's really about how to bring them together in a more coordinated role. We need to have partners and friends if we are to stand a chance at all responding to the next outbreak well.
The key to our function as an educational hub is to get the right people in the room, the right people watching the webinar, the right people doing the master's course. These are early career professionals that a country would see as the future leaders.
At the Center for Infectious Disease Emergencies, we believe that we are the leader in the master's degree programs of outbreak preparedness and response. We have 11 modules in our program, 3 core and 8 elective modules covering a wide range of topics. It is not project-based, it's coursework-based. So we have real-world experiences, we have the best internationally recognized experts, locally recognized experts. We endeavor to provide the participants with a real overview of almost all aspects that should be considered when facing a pandemic, from preparedness to response.
The idea is, if you want to know more, you want to go into the next pandemic and you want to have a good basic grasp of the fundamentals, then I think this would be a good course for you to attend, because then you get to understand the basic principles, you get to ask questions. I believe there's different modes of learning, and so you essentially are better prepared.
We really want our students to form their own networks that 3 years down the line, 5 years down the line, 10 years down the line, they'll be able to pick up the phone and call someone, their classmate who they did the master's together with, and say, hey, there's something happening in my region, have you heard about it in yours? Even if you need to respond to something, to come together, to understand your resources, to share information, to share knowledge, and just to share experiences.
One of the central resources that CIDER has is that they have this wonderful book that many experts from around the world have contributed to, which captures the wisdom and experience of COVID-19 into one location. And we hope that it will be a living book that will be revised as we go along.
This book is unique in that it's not just a public health book. It's a book about the importance of resilience in healthcare systems, about the importance of healthy populations, and good public health, which is supported by good laboratories.
I see it as two things. It's a teaching tool, but it's also a kind of compilation of best practice. So I think it's a reference book as well, like this is the state of the art on response. So you don't have to be enrolled in the course to find this useful. If you're a government planner or in charge of a major university or some institution and you want to understand holistically how to respond to emergencies, this would be a great book to have.
From China, then coming back, and the job was to find out what was happening, what was the impact, and what had China done that had worked to control their outbreak. If there was a bigger body of people that understood the science of outbreak preparedness and response, then there could have been more voices in each country giving the same message. Listen to the expert group that has been to the epicenter of the outbreak. Let's act now, not next month, not next week. We have things to do now to protect our country, to protect our people. And I found it incredibly distressing when we couldn't get that message across. But as I reflect, maybe it's because too many people that influence government strategies and policies don't understand the science and the impact of outbreak preparedness and response. So I think if we can increase that pool of people, then the world has a better chance next pandemic.